Ever felt like you are trying to get every last detail just right or ensuring perfect precision in a task that is incredibly important for your health and well-being? Today we are going to dive into a common scenario that fits right into that feeling, making sure your insulin delivery is as accurate as possible. When preparing an insulin syringe, encountering small air bubbles is a very common occurrence. The straightforward way to remove these bubbles is to gently tap the syringe body with your finger and then carefully push the plunger until the air is completely expelled. After the air is gone, confirm your correct dose is perfectly visible. This simple yet crucial action helps ensure you consistently receive the precise amount of medication you need for effective diabetes management. Removing air bubbles is important for two main reasons that directly impact your care. First, it ensures the accuracy of your insulin dose. If air takes up space in the syringe barrel, it means you might not be receiving the full amount of insulin prescribed, which could affect your blood sugar levels. Second, injecting a significant amount of air can cause a slight, temporary discomfort or a small localized lump under the skin, although it is generally not considered medically dangerous. Your comfort and dosing accuracy are both key. Let us walk through a practical, step-by-step guide to make this an easy and confident part of your daily routine. Begin by preparing your syringe. Before you even draw insulin, pull back the plunger to the mark that matches your prescribed dose. This fills the syringe with an equivalent amount of air. Next, carefully insert the needle into your insulin vial and push all that air into the vial. This technique is often called priming the vial and helps to create a slight positive pressure, making it much easier to draw the insulin accurately and smoothly. Now, with the needle still firmly in the vial, carefully turn both the syringe and the insulin vial completely upside down. Holding them together, slowly pull the plunger back past your prescribed dose by a small, extra amount. This slight overfill provides a little bit of wiggle room, making it much simpler to correct for any potential air bubbles that might appear without losing any of your essential insulin dose. Take a moment to inspect the syringe thoroughly for any visible air bubbles. If you spot some, gently flick or tap the side of the syringe with your finger or knuckle. This gentle tapping encourages any trapped bubbles to rise efficiently to the top, directly beneath the needle. Once those bubbles have gathered at the top, carefully push the plunger upward to expel just the air back into the vial. Then, recheck your dose one last time to ensure it is perfectly accurate and ready for injection. It is good to remember that while thoroughness is key, tiny, pinpoint bubbles that sometimes cling stubbornly to the plunger tip are usually not a significant concern. These are often referred to as dead space, air, and do not typically affect your dosage. Your primary goal is always to eliminate larger, noticeable bubbles that could genuinely displace a significant portion of your dose. Consistently practicing this proper technique will build your confidence and ensure your insulin delivery is always as precise and effective as possible. Mastering the simple yet vital skill of confidently removing air from your insulin syringe is truly a foundational step in safe and effective diabetes management. By taking just a moment to ensure your dose is perfectly measured and bubble-free, you are actively taking control and contributing significantly to your overall well-being. This attention to detail is a small step, but it delivers a big impact on maintaining consistent blood sugar control and supporting your healthy lifestyle journey.